not meet with you, they're going to be joining in. If I did not meet with you, and you need to meet with me, stay on after the exam review. I just had several people that I need to meet with. So for my exam review, it'll be really quick. I go through the content quickly. I have a PowerPoint. I don't spend a lot of time doing questions and answers because I don't find that that's productive. So if you have questions and answers at the end, then please do that. But my exam reviews are really to go over content, and then the content should be what you need to know for the exam. The exam is 50 questions. We will have 5 math. You guys are required to have a whiteboard for the math, so make sure you have that going. And what else? 50 questions, 5 math. You will have select all that apply, so just be prepared for that. Let me just find what we're doing here. And any questions at all on the basis of the test? All right, so for our exam, what I want you guys to know is we do have a lot of content that we've covered so far. And so I will share that with you in just one moment. You don't have to be on camera if you don't want to. You can if you want, it doesn't matter. All right, so here's our exam prep. This is in your study tools, okay, that you can study with. Just remember that we discussed in our first week, we talked about cultures, values, beliefs. Know these keywords are cultural competency, ethnocentrism, cultural relativism, and the importance of interpreters. We took a look at some OB pieces and some anatomy and physiology. We looked at the uterus, the cervix, ovary, your fallopian tubes, and how that all works together. Just remember, we do screenings, breast exams, and pap tests. We're going to look at think about comorbidities, exercise, contraception, vaccines, and who's are socially and economically vulnerable, and how with any of those things affect pregnancy. Prenatal care is very important. We want to do a nice history and physical on it. Okay. We want to make sure we're screening for abuse and depression. We do know that that is higher during pregnancy. So keep that in mind. So we do think about conception and early pregnancy. We know that we have different phases of our embryonic development. Okay. What is our purpose of our amniotic fluid? We can have too much, we can have too little. Our umbilical cord, we have IV, 1 vein, 2 arteries surrounded by Wharton's jelly, and we use that and the placenta to exchange oxygen, nutrients, and waste. Remember, what are some things that will affect placental perfusion is going to be our circulation to our patients. We looked at genes, autosomal recessive and dominant. Remember, when it's recessive, that means that 2 people have to have it in order to get it. And then if it's dominant, 1 person has it, they can pass it along. So dominant means stronger, recessive, you need 2 of them. Here are some tests that we looked at as well. You have your Down syndrome, trisomy 18, molar pregnancy, and multiple gestation. We look at all those with our first testing. Early pregnancy, we can test the amniotic fluid 2 separate ways. We will do it in early pregnancy. We're checking for our Downs, for our trisomy sometimes. If your lab work comes back. And then we have late pregnancy, we'll check for lung maturity and we will give some surfactant if necessary. Common trisomies, 21, 18, 13. 18 and 13 are fatal. 21 you can live with. We have neural tube defects. This is going to be developmentally during pregnancy. You're going to make sure that your prenatal visit includes folic acid. In order to figure out a due date, we do last menstrual period plus 7 days and then minus 3 months. We have gravity and parity. Remember, gravity is the number of pregnancies, regardless of how they had an outcome. And parity is how many have reached 20 weeks gestation. So we have a multipar and a prime, they're called. All right, we have signs and symptoms and adaptations of pregnancy. Remember, we have some that are probable, presumptive, and positive. Positive, fetal heart rate heard by Doppler, and when we see the baby. All the other ones are kind of like subjective, like maybe you missed your period, maybe you're pregnant, maybe you missed your period for some other reason. Musculoskeletal, you can get some leg cramps, you can have skin stuff, you have changes in progesterone and estrogen. Progesterone is going to protect the pregnancy, and estrogen helps with your uterine enlargement. You have GI problems, renal, extra blood. Prenatal care, first prenatal visit, we looked at that. Don't forget your Rh positive and Rh negative. We want to look at dietary considerations, weight gain, nutrition. What are some important things? Nutrition, complex carbs or folic acid or iron, and make sure we have those, those proteins if we're vegetarian. We look at high-risk pregnancy assessments. We look at genetics, medical conditions. We teach about fetal counts, make sure they're kicking. And then we talk about labor and birth, and we did that this week. We have our passageway, powers, position, and psychological. So we have true versus false labor. True labor, we know, is when we have a change in our dilation, and contractions are regular versus irregular, but I don't always go with that. But if you had to know, you'd say they're more regular. Remember, we have our first stage, which is our onset to 10 centimeters. We have 3 phases during that: latent, active, and transition. We have our second stage, which is pushing and delivery of the baby. And then we have placenta and then postpartum. We talked about medicines and considerations with monitoring the baby and fetal heart patterns. We talked about veal chop. Remember what goes with what and which is most concerning. We take a look at these fetal hearts, and this one, we see lack of variability. We see decelerations. So those aren't usually good. There's different ways to treat those fetal ones. We talked about that. I'm going to skip ahead because my class, we just covered that, and that's primarily who's here. All right, test taking strategies. Make sure you rephrase. Select all that apply is true or false. So go down the questions and do that. Understand the question. Avoid the what if game. What if the patient is doing such X, Y, and Z? Plan interventions from least invasive to most invasive. 5 math questions, thing you may see. Remember, this was on one of your quizzes. Micrograms to milligrams. It was micrograms to milligrams. Remember, you have to go to grams and then continue on. Drop factor, intake, and output can be on there. Any of those math stuff. And then on this slide, which is in your resources, you will have practice questions, answers, and rationales. Any questions on what I've presented as of yet? Okay, there are other exam reviews. I present this way. I present the material quickly and clearly to you. What I suggest is you listen to this and watch this, as you'll see the information that was covered here on your exams. Okay, any other questions?
No.
Yeah, after the exam is over,
Uh-huh.
can we put the camera off and walk away until time to come back?
Yep. So you guys will have 75 minutes and then you'll come back to class after that. Okay.
Okay, thank you.
You're welcome. Good night, everybody. If you want to stay on and talk to me, just stay on.
So just confirming, we do turn off our cameras when we take the test?
No. He said after the test. When you're done
Oh,
the
after.
test.
Okay.
Yeah.
Okay. I was just confirming. Thank you.